Welcome to this tutorial on diabetic ketoacidosis treatment. First, let's talk about what DKA is. DKA is a life-threatening problem that affects people with type 1 diabetes. It occurs when the body starts breaking down fat at a rate that is much too fast. The liver processes the fat into a fuel called ketones, which then causes the blood to become acidic. The treatment for DKA is typically the two-bag system to decrease the glucose levels. To meet the criteria for DKA, a patient must have a blood glucose level above 200 milligrams per deciliter, metabolic acidosis with the bicarbonate under 15 or a blood gas pH under 7.3, and associated ketonuria or ketonemia, either ketones in the urine or ketones in the blood. To treat DKA, a two-bag system is typically used. The two-bag system is most commonly used in pediatric patients. Although adults may also be treated with the two-bag system, it is not the standard of practice. The purpose of the two-bag system is to provide fluid resuscitation and also glucose correction. The two main fluids used are normal saline with electrolytes and D10 with electrolytes as well. Now that we have learned about DKA basics, we are ready to put it into practice. Before we enter the patient's room, we need to calculate 4 things. 1, the weight. 2, the maintenance fluids. 3, the insulin drip rate. And 4, the normal saline and the D10 rates. For this video, we will be following the Children's Hospital of Orange County protocol, but this video can be adapted to any hospital protocol. The first thing we need to calculate is the weight. I already know my patient is 30 kilograms. The second thing is maintenance fluids. For the first 10 kilograms, maintenance fluids will be 100 milliliters per kilogram. For the second 10 kilograms, maintenance fluids will be 50 milliliters per kilogram. And for the remaining weight, maintenance fluids will be 20 milliliters per kilogram. In total, this gives us 1,700 milliliters over 24 hours. According to the protocol, we also need to multiply 1,700 by 1.5 to ensure adequate hydration. This gives us 106 milliliters per hour after rounding. The third thing we need to calculate is insulin. Per protocol, the insulin drip rate will be 0.1 units per kilogram per hour. Factoring in our weight, this gives us 3 units per hour. The available concentration we have is 100 units per 100 milliliters. This gives us an insulin drip rate of 3 milliliters per hour. The final thing we need to calculate before we enter the patient's room is the normal saline and the D10 fluid rates. Because I know my blood glucose is 230, and because I am following the CHOC protocol and the table in the protocol, I know that my normal saline and D10 fluid rates must be set at 50% of the maintenance fluid rate. This means that when we factor in the 106 milliliters, we will divide it in half so that normal saline is running at 50% and D10 is also running at 50%. This gives us a rate of 53 milliliters per hour for each fluid. Now that we have calculated all of the medication math, we are ready to assemble our equipment and enter the patient's room. This table was the one referred to calculate our normal saline and D10 fluid resuscitation rates. For our example blood glucose of 230, we can see that this falls under phase 2. This means that instead of giving 100% of our maintenance fluid rate as strictly normal saline, we will be splitting the maintenance fluid rate between the normal saline and the D10. This is how we calculated the rate of 53 milliliters per hour instead of the 106 milliliters per hour previously calculated for the maintenance rate. If we reassessed and received a blood glucose
of 120, then we would be giving 100% of the fluid rate to D10 half normal saline. We would use this table for every reassessment of the blood glucose every hour. To begin the 2-bag system, we need to assemble our equipment. We need 3 sets of primary tubing, 1 bag of normal saline with electrolytes, and 1 bag of D10 half normal saline with electrolytes as well. We also need a bag of insulin for our insulin drip. The reason that we need 3 sets of primary tubing is because each bag of fluid will be set up as its own primary channel.
Now that we have completed our pre-procedures checklist and assembled our equipment, we are ready to begin the 2-bag system. I have already assembled our equipment, which consists of 1 bag of D10 half normal saline with 20 milliequivalents of potassium chloride and 20 milliequivalents of potassium phosphate. I also have a second bag of normal saline with 20 milliequivalents of potassium chloride and 20 milliequivalents of potassium phosphate. These 2 bags are our maintenance fluids that will be adjusted as needed. The third bag is the insulin. This will be for our insulin drip. I also have 3 sets of primary tubing, which are already primed. After we have gathered equipment, we are now ready to program the pump. I have already programmed the pump to reflect our calculations. For the maintenance fluids of the normal saline and D10, I have set the rate at 53 milliliters per hour for a volume to be infused of 53 milliliters. This ensures that we will be in the patient's room at the end of the infusion to reassess her blood glucose and her neurological status. For the insulin, I have also programmed this to be 3 milliliters per hour for an infusion of 3 milliliters. Before I press start on the insulin, I need to double check this with another nurse. After I have double checked this with another nurse and verified all of my rates are correct, I can now begin the infusion and connect it to my patient.
After we begin the 2-bag system, we need to monitor our patient continually. We need to complete neurochecks every 1 hour to assess for signs and symptoms of cerebral edema, as fluid and electrolyte balances may have shifted. We also need to reassess the blood glucose every hour to determine if the fluid rates need to be titrated up or down. We also need to measure the inputs and outputs every 1 hour. Vital signs must also be checked every 1 hour. Labs, specifically BMPs, need to be drawn every 2 hours for 6 hours, then every 4 hours after that if they are improving. Thank you for watching this educational video about DKA and the 2-bag system.